Hello. A very good morning to everybody. At the outset, I would like to thank Dr. Amar Pujari, who's the chief author, along with my co-authors, Dr. Sujit and Dr. Rajeshwari. And I would also like to thank AIOS Scientific Committee for giving me this opportunity. So my topic is extraocular muscle anatomy teachings for ophthalmology residents on goat's eye. The purpose was to demonstrate the possibility of extraocular muscle anatomy on goat's eye, which we've intended to mimic like a human eye. The method was that initially what we did was inspected the integrity, clarity, and residual extraocular muscles of the goat's eye. Then we found eyes with more than 15 millimeters of extraocular muscles, and from there we initially explored the insertions where a maximum of 3 recti and superior oblique muscle seemed like that of human eyes. And to supplement the inferior oblique muscle and the missing recti muscles, the residual muscle stumps were harvested from the other eyes. For example, coming to the picture on the left side, here you can see that normally inserted muscle is there in the goat's eye. It's kind of replicating that of a recti. We have placed 4-0 silk sutures at the free end in order to mimic normal muscle tension. In the center image, there we can appreciate that there are 4 muscles. The image on the muscle on the extreme left, it's the inferior rectus muscle. The muscle which is evident on the top is the lateral rectus, and just underneath it lies the inferior oblique muscle, which is coursing along the globe. And superiorly, in the most right aspect, we can appreciate that there is superior rectus muscle. The picture on the extreme right has 2 muscles. The muscle which has been hooked upwards is the superior rectus muscle, and the muscle which has been retracted downwards is the superior oblique muscle. In this way, we have managed to demonstrate all 4 recti muscles and 2 oblique muscles on 10 different occasions successfully. The Teenan's muscle relation, muscle insertion, and their anatomical orientation were reliably taught. In addition, simple surgeries like recession, resection, and plications were also demonstrated. And even we were able to demonstrate complex strabismus surgeries like Knapp's procedure in the later on trials. So this is a photograph where we are trying to demonstrate resection of the muscle. We have placed 2 muscle hooks, and then we have resected the muscle. Here we are trying to do a recession of the extraocular muscle. So first you can see on the image on the top left that the muscle is normally inserted. However, in the image in the top bottom right, the muscle has been recessed. We have also tried doing wide splitting of muscles and even done partial nishida. So coming to the conclusion, on goat's eye, all the extraocular muscle anatomies can be successfully simulated on par with human eyes for residents training. We have also published these teachings. Yeah, thank you.
Yes. Did you fix the muscles, and did you note that upper and lower side of this? Once
Yes,
you
sir.
start resecting, the eyeball will be rotated, and you will not know. The students, of course, don't know that is taken.
So while performing that, first we usually use the gauge pieces, rotate it, and fix the eyeball. The goat's eye, we have fixed it using multiple layers of gauge pieces so that it doesn't move, and fixed it within the cadaver. The mannequin which is used for performing phaco-emulsification simulations were used. We have fixed the eyeballs. We're using gauge pieces, and then using the extraocular muscles, we are able to demonstrate it very clearly. The students were very happy with the results.
Once demonstrated, could you mark it with the ink so that it will not be formed?
Yes, sir, we did actually. Unfortunately, we don't have images of that. Like I had videos of that, so which I don't have.
Have you tried resecting and recessing and suturing also?
Yes, sir.
Or it is what just demonstration of the muscles?
No, we have done resection as well as plication as well. Even tucking we have performed.
So what difference you felt from human eyes?
So the thing is that the exact tension which we feel while performing a strabismus surgery on human beings cannot be replicated. But then again, to some extent, we are able to demonstrate the anatomy which happens, like the changes which happens during the time of surgery. So it gives a better understanding for the students. But then again, it may not be excellent for the surgeon himself.
It's good learning tool. Nice. Good
Thank you,
present.
sir.